Let's do a crash course or basics on perimenopause. I didn't learn this in med school. It's very unlikely that you learned this anywhere else. So I'm just going to go through the basics here. This is likely going to be part one of other things. If you have other questions or concerns, thoughts, comments on perimenopause, leave them below. I will try to get back to them via video or comments as best as I can. During this video, you will hear baby noises. So she's fine. She's just playing. Okay, first thing, what is perimenopause? How do we get that word? So it means around menopause. Menopause is when all your hormones are low and you stop cycling. Leading up to that, as your egg count starts to decline, hormones fluctuate wildly. This is the most symptomatic time of this whole transition. When your hormones go up and down, that's when you have the most symptoms, not just during menopause. We talk about menopause all the time, but when it comes to perimenopause, this is when the symptoms occur. And we can define it as the onset of cycle irregularities or your period starting to vary, or the onset of any menopausal-like symptoms. So you can have regular cycles, but if you're having regular cycles and you have symptoms that are related to menopause, you can still be in perimenopause. So that's important. One thing to note. The other thing to note is that it can happen as early as your 30s. Mid-30s, you can be in perimenopause. It can start a lot sooner for some than they anticipate. The range of the time frame of being in perimenopause can be 2 to 12 years, average about 4 years. And the last thing I want to go over with you on perimenopause here is that there is no universally accepted diagnostic criteria or one single lab that can help you diagnose perimenopause. We use symptoms, cycle information, age, and sometimes labs to help gather and figure out, what's going on and help decide if you're in perimenopause. So this is why women go years without a diagnosis or thinking it's one thing. I've had a lot of patients with frozen shoulders. And then they found out, oh, that must have been perimenopause or joint pain. And I'll go through the list. I'll do a video again on lists that are not just hot flashes and night sweat. It's not just fatigue. It's not just weight gain. There's a lot of different things. But I just wanted to give you sort of the basics of what is perimenopause. How do we define it? How do we not define it? So hopefully that's helpful. And let me know what questions you have for future videos.